I will go on further to say that if you ask most health economists about the benefit and usefulness of the FDA, they will almost all say that the FDA is overly restrictive and they would favor freer markets. And some propose specific piecemeal decontrol. Others favor creating a free market and abolishing this agency. I'm not suggesting that, but I'm just saying there are experts out there who are suggesting it. So we can't live in this blind world that we do, where it's really none of our business, or that we're too apathetic to do anything. It's difficult to find a single economist who defends or supports the contemporary FDA. And I'll just mention a few. Gary Becker, Nobel laureate of 2003, experience indicates that the FDA frequently has delayed approval to avoid embarrassing political and medical mistakes. Eliminating all requirements except a reasonable safety standard would vastly reduce drug prices in the US, as companies would be encouraged to develop additional compounds to compete for customers. John Calfee says there's very strong evidence the FDA suppresses a great deal of useful information. Experience from related markets in this nation and abroad also strongly indicates that informational competition involving drugs and devices is likely to work well, and that the pharmaceutical market does not pose unique problems that make it unsuitable for traditional competitive dynamics. Milton Friedman, another Nobel laureate, not known for being shy linguistically, says the FDA has done enormous harm to the health of the American public. And when asked if you could do anything to improve the health of America, what would you do? Friedman said, no more licensing of doctors, no more regulation of drugs, not of any kind, period. Now, obviously, that is an extreme state, but this is a serious guy. And so there is, I'm sure, room for us to make some major changes. There are some crazy comments that come out from people like David Kessler, who until recently was the dean at UCSF, when he said in 1992, it is too great a burden for average Americans to make decisions concerning their own health care. What nonsense is that? If members of our society were empowered to make their own decisions, then the whole rationale for the agency, the FDA, would cease to exist. I can follow that. To argue that people ought to be able to choose their own risks, that government should not intervene, is to impose an unrealistic burden on the people. This guy has not seen his own ass. He might get a shock. Okay, so I told you to begin with that these gentlemen and ladies gave me some ideas about how to overhaul the healthcare system. And first of all, they suggested, most of them, a universal healthcare insurance system, a requirement for all inhabitants of the U.S., that we should enhance the Medicare and VA systems, maybe amalgamating the two. I don't really see why we should have a separate VA system, actually. That we should require the federal and state legislators, those senators sitting up there in D.C., to use and appreciate the standard Medicare and VA system instead of their privileged health care. That if we're going to have an independent health insurance, that there should be some sort of single-payer system wherein we do not have to go and look up these explicit instructions and regulations for 100 different insurance companies. There should be emphasis on prevention rather than treatment. That we should deregulate most healthcare regulations except the core essential ones. That medical tort reform should be introduced. That we should serve the underserved. That we should introduce volunteerism. That there should be a requirement for newly qualified physicians, for instance, to serve in underserved communities, probably in primary care, before specialty training. Pay them well. Forgive their student loans. And make sure there's very limited medical malpractice and compliance regulations. Make it easy for them to do a good job. Fix the FDA. It's broken. It's opaque. It's hamstrung with isolation. It takes too long and its focus is all wrong. Provide a system of transparent peer review and decision-making process to help both patients and businesses. The panels reviewing these devices need to be made up of people who really know about devices. Now, Richard Felton was telling us last year at Controversies that they're going to introduce in these advisory panels, but the people who are on these panels can't have had any contamination with the laser industry previously. It's just not going to work. The people who know about devices have all been involved with the laser companies, and good for it. Where would we be if we had no association with the pharmaceutical and device companies? We'd be nowhere. The data submitted to the FDA for approvals by drug and device companies should be made immediately available upon clearance of any product. Serious, concise, and truthful post-market reporting should be required of all companies. Empower physicians to do what they do best, take care of people with real problems and train each other. As for certification, people who wield lasers should have at least some medical degree initials after their name, be directly supervised by a real physician, and both should be required to go to a laser college of some sort, take refresher courses, and actually pass a test. And that the U.S. healthcare system is suffering because it's about money and not people. You know, I've gone on a little bit long here. I just want to say a few things about quackery because it is relevant. Most human beings will do almost anything to prolong their existence or to relieve the suffering of disease. Others will do anything to exploit these desires by selling what they claim to be pain-killing remedies or life-prolonging nostrums. And this is still very active. Quackery is still alive and well, as reported in this particular presentation. Oddly enough, the existence of quacks originally helped to legitimize the medical profession when it wasn't really recognized or legitimized, and acted as an impetus for demands of greater transparency, therapeutic rationality, and ultimately controlled in medicine, which is exactly what we've just been talking about for the last 15 minutes. William Helfand correctly noted that the promotion of bogus health-related products has never ceased, and in our own time it has found perhaps the most potent vehicle ever invented, the Internet. And of course it's been the subject of many artists, etc., which I won't dwell on. I will just say one thing, that in my opinion, mesotherapy is quackery, period. I don't want to discuss it, it's nonsense. When nature won't, Pluto water will. So in ending, searching for a common truth, I would ask you as an audience, how big a pill are you prepared to swallow to solve the healthcare crisis? Because without it, the US is inevitably going to spiral out of control. And I will just finish by giving some rules for success and happiness in medicine. Treat all patients as if they were members of your own family. Always tell the truth. Don't be afraid to ask questions or ask for help. Learn to say, I don't know, and I'm sorry. Thank every patient who comes to see you so they understand that you feel it's a privilege to take care of them. Take care of yourself. I don't do this. Exercise, take vacations, learn to say no. I certainly don't do that. But finally, never sacrifice your dignity to make money, but charge what you are worth. Thank you very much.